Is that kind of the area, roughly?
Yeah.
Okay, gotcha. And is that it? That's the patellar ligament. How is it out here? How about the joint line? Okay, and how about there? That's okay? Yeah, runners get this most of it. We're going to go medial collateral ligament. Patellar ligament's going to be big. We'll do obviously, as a maintenance thing, joint line, lateral, we're going to focus there. I'm just prepping a knee. We're going to do some prolotherapy. Prolotherapy, as you probably know, is a proliferating agent that helps to repair damaged ligaments, tendons, and some of the joint cartilage, mostly by stabilizing the knee. This gentleman is a very athletic, active gentleman. He's doing an ultramarathon in a few months. So he shared with me where it hurts. And after I do a little cleaning, this is just simply betadine. This is a sterile marker. It's a one-time use. So he's having pain along the inside of his knee. There's a large ligament here called the medial collateral ligament. It's like a big, thick wad of chewing gum that goes from the femur all the way down here to the tibia, the lower of the shin bone. It actually attaches to your meniscus, your cartilage in your knee. It's also having pain right there in the front. And that is your patellar ligament. And that's basically the hinge that allows your knee to extend. So all I basically do is, for my visual aid, is I draw. It's having some pain right under there. That's one of the most common areas to get it. I'm going to find the edge of this patellar ligament. All right, and now what we're going to do is we're going to come over here. I'm going to find his joint line. You can kind of feel a little gap right there. This is a big, thick ligament right here. For a runner, this is important because if this is unstable, imagine having a car tire on a car that you drive cross-country and the brackets or the screws that hold the tire in place are loose. The car starts to wiggle like that. And it's going to cause a lot of stress on structures that aren't designed for that. And even though he's not having difficulty in other areas, we want to do a maintenance. So Prolo is just a combination of dextrose, a natural sugar, a substance called serapin. It's a natural substance that comes from the pitcher plant. It acts as a proliferant agent. It helps to stimulate growth. And then just saline. This is the lateral collateral ligament. It's much skinnier. Last thing I want to just find a weight in the knee. You can go here or here. Most people have a little more space right there. That's my bullseye. So I'm going to go right here. 1, 2, 3, pinch. And Larry, one more. 1, 2, 3, pinch. Last one. 1, 2, 3, pinch. This is going to cause an inflammatory reaction. So certain things you want to be off of. So anti-inflammatory medications. You also want to be off of certain supplements you might be on. Turmeric or curcumin, ashwagandha, CBDs, omega-3s. So you're basically mimicking an injury. The body goes, I don't like this. So it sends up your macrophages, which start to eat the damaged tissue. And then it sends in what are called fibroblasts. And fibroblasts are cells that bring collagen fibers. Collagen's that protein that forms our skin, our hair, our ligaments, tendons, but if you stimulate that, the body can help repair. It can actually help bring new blood vessel growth in as well, is what we really want. May I do one more here, just to be safe? 1, 2, 3, pinch. Good. Last thing I'm going to do is use a slightly stronger solution, and we'll see. This is 5 cc's. You may not need all of that. Are you ready? 1, 2, 3. There we go. You all right? If it starts to feel too uncomfortable, you let me know. Everyone's joint space is a little different. I think that's good. That's about 4 cc's in there. Last thing I want to do is I have a little ozone gas. Ozone is very antimicrobial, stimulates the immune system, gives a boost of oxygen too, helps to heal. All right, last thing, 1, 2, 3. There it goes. And we are out. That is prolotherapy in a nutshell. If you have any questions, look at our website, HRMregendoc. Thank you. Our patients done prolotherapy. After certain procedures, we like to do red light therapy. A lot of people know about red light, blue light, near infrared light, good for skin, good for healing. We found it has benefits for weight loss, gives the body energy in the form of ATP, which is one of the ways the body uses energy. It also has what's called a photodynamic effect. It can warm the tissues up just a little bit. Doesn't seem significant, but it's enough that increases metabolism. For someone who's just had a joint done, they're a little bit achy and gimpy, you will find that it warms things up. When we do birth tissue products, they metabolize faster. You can actually put them under that red light, and they find like stem cells, they'll start dividing and moving faster, so they do a better effect. Patient's job is to come in, lay down, and relax.